Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and today I am here not only with Dr. Millicent Rovelo. How are you doing, Millicent?
I'm doing great, thank you.
We have some very special guests.
Super special.
We do. I am thrilled
They're looking around.
to have with us today Dr. and Mrs. Guinea Pig, Dr. Terry Dubrow, and Heather Dubrow.
Yay!
We are very excited to have you all, and we have to tell our listeners, as though you need introduction, but we're going to tell our listeners a little bit about what you guys do and who you are, because most people know you as Real Housewives of Orange County, the Botched Doctor, Real Housewives, etc. But the two of you have an extensive Hollywood background, an extensive plastic surgery background, and an extensive family background that I know everybody wants to hear about. And then we have a little surgical story to tell, too, which is kind of cool.
Yes,
we do.
Yeah, we want to hear all about it. So it's going to be fun.
It was awesome.
Well, good. That's good to hear.
Awesome.
That's a good tee off.
There's a reason why I chose you, because you're awesome.
Oh, well.
You're just incredible.
Well, he just sort of, broke the punchline there, but
Oh, did I?
No, it's all good.
Did I?
I think
we already know.
The cat's out of the
we
bag.
know why we're here.
Yeah, of course.
But just in case,
Go ahead.
we don't know.
Why don't you tell everybody about Dr. Dubrow?
Dr. Dubrow, a man who really needs no introduction, a true celebrity plastic surgeon, but really an amazing plastic surgeon, very well trained, very well educated, a UCLA man.
Yep.
And he's done many TV shows. He's written many books with his lovely wife, Heather Dubrow.
We have written a lot of books.
Yeah, you
Are we
guys have
writing more
written a
books or are we
few.
done?
I think
We might be done.
we might be done.
You never
Do
know.
we have anything more to say? Haven't we said it all?
We do have more to say, but maybe not in print.
That's right.
We hope you have more to say because you guys
We're
are
gonna say it
here
today.
on our podcast. And thank you very much for coming.
Oh, it's our pleasure.
Yeah, we're so excited to be here. Obviously, Jay, we've known you for a million years,
Since Temple Bat Yam.
since Temple Bat Yam days, and our families have known each other for many years. And I just think you're fantastic. Millicent, it's lovely to meet you, and we're just really excited to be here.
Well, we are so happy to have you. And obviously, I wanted to kind of go through some of your credits because I don't think everybody knows that you were a totally amazing TV star before you even met this guy.
Yeah.
And then, had credits with, television, film. You're a producer. Anyone who wants to get the whole list, go on IMDb.
Go to my IMDb.
You'll be
If
blown
you know,
out of the
you
water.
know.
That's right. And of course, now for being an author, a producer of. I think you produced an episode of Botched. I saw too. Were you on?
Well, I was a producer
you were credited
on
or something.
Botched Post-Op,
Yeah, something.
which
It
was an
cool.
after show that I hosted for
And
Botched.
actually, let's be honest, you were the showrunner, the executive producer.
I wrote the show.
You really did.
Yeah.
Yeah, so that was
that's awesome.
a one-woman show.
Yes, it was.
Well, that's awesome. But now you have your podcast called Let's Talk with Heather Dubrow, and that is on the Podcast One network.
Yes, it is.
Of course, and then your YouTube. There's so much. So anybody who needs to learn more about Heather Dubrow, please check all of it out. It's incredible. It's a great
All at
story.
heatherdubrow.com.
That's right, all there. And for Terry, obviously being the Botched Doctor, I'm sorry. There's probably moments that's been pretty rough, and there's been moments that it's been probably so incredible.
Oh.
You can't believe that whole show happened.
It's incredible. It continues to be incredible. It's so fun. It's getting more interesting as time goes on.
And it's still going.
Yeah.
How many seasons?
10 years. Our first episode
10
dropped
years.
in June of 2014.
There's no shortage of the botched people, huh?
I mean,
Yeah.
you think
You
people
would
would
think.
learn by now,
By now.
not to go to Tijuana.
You would think. We've had
I'm
so
just
many
saying.
PSAs on those, but
Right.
clearly not enough.
I just saw one, as a matter of fact. In fact, I operated on this poor guy, and it was a disaster.
Yeah.
Disaster.
Well, I mean, a great percentage of your practice is basically botched surgery,
Well, that's
isn't it?
true.
Oh, yeah. And
I mean, got to be 80, 70%?
Yeah, it's probably
Revisional
80,
surgery?
It's probably 80% of my rhinoplasty practice
That's
in
what I mean.
terms of time.
Yeah.
The number of cases, it's 50-50 primaries and revision rhinoplasty.
How
but
much
yeah,
of your business is rhinos?
About 80%.
80%.
Yeah, 70 to 80%. I'm getting more facelifts now because
Yeah.
I'm old and my patients have gotten old. And
Yeah.
so I'm doing about 5 to 10 facelifts a month right now.
Well, Terry always says, you want to see the gray hair.
Yeah. for
Or
sure.
no hair.
There's, I got the grays
Well,
coming in
hopefully
pretty
you
good,
don't
man.
have
I
no
would say your plastic surgeons have a lot of gray hair or no hair.
Yeah, I mean, well, that's coming. I can tell. But yeah,
On you?
The
No,
gray-
you have the
grays-
best
Oh, the
hair.
gray's coming.
The
There you
grays
go.
here, man.
Yeah,
I'm leaving it.
You're giving
I need it.
the
Yeah,
gift
it's
of hair.
good.
You got
It's
the good
good.
hair.
I got the hair. I'm happy that it's there. But I do a ton of the rhinoplasties, and with Botched, I mean, that's a big part of it. But your body stuff that you do is totally insane. The stuff you've shown me. So once in a while, like I'll be walking past Terry in the hallway, and he'll be like, "Hey, let me show you what I did," and he'll show me something that makes me go, what is that? And he'll be like, "Yeah, Mexico. It's the way it should be. It's not good."
I do a thing with a buddy of mine, Rob Schwartz in Dallas, a great plastic surgeon there, who I'll send him a picture and go, "Whoa, this just came in." And he used to go, "Oh, don't even try that. That's impossible. There's nothing you can do for that." And then I just send him the after. So now if I send him a picture, he goes, "All right, let's not play this.
Yeah.
Show me the after."
Let me see what you did.
I go, no, this just came in. It's pretty impossible. He goes, yeah, I'm not falling for this. Just send me the picture.
Yeah, it's unbelievable the stuff that you have to deal with. It is.
Yeah.
They're scary. Dr. Rovelo has her own botched practice down
Yes.
at
You
PIH
do
in
a lot of
Whittier.
revisional surgery?
Mostly breast. A lot of the awful breasts that need
Yeah.
like 13 surgeries. I've had 13 surgeries.
Yeah.
And you do
Yeah.
the big body stuff too. That's
know.
should do the same thing you
Yeah, I
do. Where she'll be
bet.
like, "Hey, take a look at this. What do you think?" I was like, "I think I'm very happy you're doing that." That's usually what I say.
How did you two
That is
meet?
good for you.
I was a USC resident, and so I met Dr. Calvert when I was going through his office doing my aesthetics rotation. And then as it came close to graduating and needing to find a job, I came out and I was like, "Dr. Calvert, hello, remember me?"
You must be really talented because he sees them all.
He sees them all. And it started from there. We kind of let me come in, take some space, rent some office space from him, and here we are.
That's great.
General surgery trained, USC, LSU. I was.
Did you do general surgery at USC?
No, at
General
LSU.
surgery at LSU
Whoa,
in New Orleans.
great trauma there.
People don't understand that.
Isn't
Can I
that
tell you
fun?
something? Because I'm married to a doctor, obviously, and it's him. I get it. But people don't understand that being a general surgeon is the classic way to become a plastic surgeon.
It used to be.
Classic.
It
But
is.
I don't know. Okay, here, the only layperson, I like to say I have a little MD, married to a doctor. But as the only real, non-doctor in the room, I mean, for me, if someone's going to operate on me, I want you to be able to crack my chest open. God forbid there's a problem. Maybe that's not even a thing that happens, but I want someone that can actually save me on the table.
Yeah,
That is
no,
not-
it shouldn't be a
not
thing.
wrong. It shouldn't be a thing. God forbid.
Not in plastic surgery.
No, I'm just saying, not a dentist.
Well, no.
Well, yeah, definitely not. But I agree with you. The general surgery used to be the classic way that it was done, which is what Terry did and what Dr. Rovelo did. I did an integrated program, so I was still at the University of Pittsburgh for 7 years, but I did 3 years of general surgery and then 2 years of research where I actually took call and ran. I did double duty. I was pretty much working as a resident during that time and running the lab, and then I did the 2-year plastics residency. So there's a lot of ways to get there, but I think you want a solid foundation either in general surgery, ENT. There's a lot of ways people become plastic surgeons now, and USC still has room for the person who's done general surgery, full general surgery, and then comes into plastics. They keep one spot a year for that.
1 or 2, yeah.
Yeah, but,
Wow.
but let's be honest. Approximately 50% of cosmetic surgery done out there is done by non-board certified plastic surgeons with no formal training in plastic surgery.
I think more.
Yeah.
It's getting more. It's getting more.
Let's do the stats right now. I mean, because think about, if you look at it, there are, 7,500 plastic surgeons in the country who are board certified by the American Board of Plastic Surgery, and there are 35,000 people doing aesthetic surgery.
Wow.
Wow.
Yes.
So
So
Wait.
that's a
So
lot
the
more.
chance that you're getting your operation by a board-certified plastic surgeon in the true ABMS sense of the word, and we talk about this all the time on this podcast, it's pretty
very low.
It's hard to check
Because people
they
hear
hide
board
it.
certified
It's so
and they don't
confusing.
ask what board.
And they're done.
Right.
Well,
Yeah.
I think there's classic ways. I'm sure you guys have discussed it, how to hide it. But the number one way is to call yourself a cosmetic surgeon. And by the way, you probably know this. You're not allowed to call yourself a plastic surgeon on your website unless you are board certified in plastic surgery.
Oh, so you should go to the website.
Yes.
Says yes,
You're just-
plastic surgeon.
Yeah.
And if you have hospital privileges is the other thing, right?
Yeah, well, you have to, yes. But I mean, you know, an ENT, well, there's a lot of great ear, nose, and throat plastic surgeons. But I mean, a general surgeon might have hospital privileges somewhere.
Yeah, exactly. And they can. It's very tricky to know who's operating on you, which is why we make the biggest deal about this all the time about getting referrals.
Yeah.
So speaking of which,
Speaking of referrals,
I got a
intro,
referral
doctor.
You did?
by FaceTime one day in the office.
Yeah, you want to tell the story, honey?
Yeah, well, I mean, I think this is what was interesting. So Terry had mentioned to me, just sort of off the cuff, that he was thinking he might. Oh no, that's not how it started. It's because you were snoring.
Yeah.
Terry was snoring so badly, and I was like, honey, you snore so badly. Like, is there a way to fix it? He goes, I don't know. My septum's probably deviated, whatever, blah, blah, blah. And he goes, but if I was going to fix that, I might as well fix it aesthetically, too. And we talked about it and then let it go. All of a sudden, we're sitting filming a scene for Real Housewives. We were in his office, and it was just like a thing. Hey, I'm popping by Terry's office just to say hi, and the crew's like, great, we're going to follow you doing that, right? Because that's how it kind of works. So I go, great. So I pop by his office. I'm sitting down. We're just like, can I swear on here?
Of course.
Go for it.
I was just like shooting the shit. We're just talking, whatever. And then Terry brings it up on camera. And I'm looking
Not
at him
planned.
like, because it was like organic to what we were talking about. I went, okay, all right, okay, we're doing that.
But
we're
I
doing
could see
that.
a little look in her like, in her eye, like, you're
Are you
going
sure?
there? Really? Yeah, 'cause
Like they're filming this right
guy,
now.
Yeah.
You shoot this much, they show this much. They're going to show this.
So for every 30 hours we film, 20 minutes makes it to the air. So you can imagine how much we film. But when it's something like significant, moves story forward, or is interesting, it gets shown. So for Terry Dubrow, famous plastic surgeon, to say, yeah, you know what, I think I'm going to have plastic surgery. That's a big deal. That's a huge deal.
So what's funny is I pull out my phone, which I always have just right there, whether it's in my scrubs, as you guys can pull out your phones right now.
Sure.
And I go, she goes, who would you have do it? I go, who else, Jake?
By the way, I knew. I knew who he was going to.
Well, you know, Jake Calvert's the best nasal
It was
surgeon in
always
the
gonna
world.
be
Let's
you.
be honest.
Yeah.
And so I said, I wonder, and this is totally unplanned. You can confirm
Yeah,
this.
I know.
we did not text you
I said-
No,
beforehand.
not at all.
And you know, he's a busy plastic surgeon. What's the chance he's out of the OR or not with the patient? He's not going to answer his phone. So I said, screw it. So I go
FaceTime.
Jay, and I hit FaceTime, and he goes, hey. I go, hey, what are you doing? And I
I
go,
was eating sushi at the time.
and I
with
go, tell him he's
That was
on-
lunch with my staff.
Is that right?
Yeah, we were having sushi like from the
Perfect
place next
timing.
door to Westcliff, and
and there's a certain meant to be to it.
Yeah,
you
yeah,
know?
yeah, yeah.
But I go, tell him he's on camera. You
Oh,
gotta
and I go,
tell
so
him.
Jay, are you on we're on camera, Housewives. Are you cool? You go, yeah, go for it. And I go, hey, why don't you do my nose? So what did I say? Do you remember?
you're like, I think you said, I'm thinking about fixing my nose, and I was kind of like, thank God. Good. Yes, it's time to lift your tip up to where it needs to be. It's ready. You're going to breathe again. I knew
Right.
that you had problems with that.
Yeah.
Because it was just, there's no way that your nose was working. I
Yeah.
knew it. And I knew that this wasn't about the looks, because if it was, it would have happened years and years ago.
It would have, but
100%.
And what's interesting is when you're on a reality show for a long time, okay, you get lots of people who say nice things and a lot of people who say
Oh, the
negative
trolls.
things. Even if you're a positive, sort of
Sure.
inspiring character, you still get the trolls.
Oh, yeah, they tell me I look like Coraline's mother. They tell me I look like the evil queen. They say I've had every. I mean, how many years have you known me for?
Yeah.
20? Like every plastic surgery in the book, all the things.
One day it will happen. It's just you
One
know,
day.
Yeah.
One day. It
Well,
hasn't happened yet.
I'm sure you guys make this joke. What do you call a person who says they'll never have plastic surgery? Pre-op.
100%. Oh,
I didn't say I wouldn't have.
Yeah,
But-
that's
They
right.
have it.
But what's
Not yet.
interesting is, you know, so I'm really, I wouldn't say immune, but I'm not that affected by either the positive or the negative that people say about me, right? Online. It's hard not to be, because if you're on a reality show, you'll have literally 1,000 positive things said about you and 7 negative, and all you do is see the negative. It's human nature.
course.
It's really weird. So anyway, so I've lived with years and years and years of plastic surgeon with that nose. That nose is terrible. That nose is getting worse. You know, constant nose comments. And I always say, oh, screw you, you know.
Yeah.
And then it doesn't bother me. But I thought, you know, wouldn't it be nice to be able to breathe? And honestly, if I'm being totally honest, equally important. I thought it'd be nice to just lift the tip and
Buff it up a
reduce
little bit.
Buff it up a little bit. Just like maybe people stop saying things, because I guess it does affect me a little bit. And I just thought it would be a good thing to do. And of course, in typical Terry Dubrow fashion, I'm going to do it on the Real Housewives of Orange County.
I mean,
Can't just like do it.
hide in plain sight.
Yeah, well, I mean, I was kind of like, all right, I'll do it with you. I didn't think you needed to do it on the show for sure, because I knew I could kind of get you a nose that nobody would really know that
And
you had it done.
And you did.
And, I said, well, you just need the tip, supported so you can, A, it'll look better, but B, it's going to change your life. I knew it would.
Mm-hmm.
I mean, because when that airway's down like that, there's no way that you can breathe through it. And it makes your sleep awful.
Yeah.
You wake up tired. Like all these things that just people don't really know about until they get it fixed.
That's right. So, I thought, because I think most people in my situation would just do it and then appear on your next program and it was done. That's certainly the way housewives do it. 99% of housewives, they will do it a week before a reunion.
Yes, but then they tell, because a lot of them get it for free. So then they tell everyone.
But they tell
who
everyone,
did
but they don't do it on
Yeah.
a TV show. How often do they do facelifts on Real
Tara
Housewives?
had her breasts done many times
but not
on
her
the show.
face. Never her face. She just always appeared with a
She
tightened
talked about
face.
it.
She talked about it. But we're talking about
Filming it.
Filming it.
Yeah.
Yeah, we're like going to do this like documentary stuff.
Yeah.
That's kind of what I understood. And I was like, sure, I didn't have a problem with it. I thought it'd be great for a lot of reasons. One, because you are a plastic surgeon. You're saying, well, this plastic surgery is going to help me, which is great. And, we're sort of believers in the services we provide. And we do talk about it on this podcast. I mean, we've talked about, Millicent's talked about her mid-face and her brow and all these other things. And it's really powerful for people to hear it from those of us who are not only, doing this stuff, but also
users of
Patients.
the services.
Yeah.
We believe in it.
Yeah, so I went home and I shot the scene, and I remember that night I sort of, as a guy my age will tend to do, wake up at 2 a.m. to have to use the restroom, the BPH. I woke up, I walk into the bathroom and I go, am I high?
What am I thinking?
What? Am I an idiot? What? And then, in typical me fashion, I just went, oh, whatever, go back to bed. And then I just didn't think about it, and then it happened.
Yeah, we did the consult, and I was like, I knew that it was going to help you a lot.
Yeah.
And I also knew I didn't want to overdo it. That was a big part of it, because you have a look.
Yeah.
And I wanted to do this for you in a way that we didn't take away your look, but we improved it. And that's really the key. So there was a functional component, and then there's also that aesthetic component that's really crucial. You don't want to look like you've had
And I thought
done.
there would be an equal amount of trolling post-op if it changed too much.
Yeah, for sure.
Yeah.
But also,
The
thing for my thing with plastic surgery is you want to look like a better version of you,
Right.
Not I mean, I guess some people want to look like a different person, but that to me is the best kind of surgery. So when I look at Terry's face, it's like this is the nose he was supposed to have.
Yeah. Just take away 80% of the ugly. Of the nose, by the way.
Yeah.
It's not ugly.
The nose was, and it's, hideous.
It wasn't
Ask
hideous.
Twitter, or X, formerly known as Twitter, if you want evidence.
Well, so you're how far out now? We're filming this now.
So 4 months only. So obviously
months.
still
Still
quite
fresh.
swollen. I'll tell you, one of the most powerful things that I did in terms of just swelling was because of the sebaceous sort of oily nature of the nose and the big open pores that get plugged, that metronidazole.
It works.
Just talking about that yesterday.
I mean, because this is probably TMI, but I'm going to share it. Sort of a favorite pastime of mine is to go over to that magnifying mirror and start to squeeze the pores out. And I do that now, and it's sort of disappointing. Nothing.
Yeah,
it's
there's
not
nothing much there.
There's nothing.
What is
there.
that gel? What does it do?
It cuts down the bacterial counts in the pores, basically. I mean, metronidazole is an antibacterial agent that for rosacea, which is what a lot of people have, through their face, on their nose, and you see it, rosacea gone crazy really becomes rhinophyma.
No,
you don't have. You're good.
But it has like an anti-inflammatory component to it. So for people that have rosacea, or if it's gone to the nose and the nose has gotten really swollen, it really helps bring that swelling down and that coarse skin texture.
How long does it take for a nose to look like it's going to look?
A year, right?
Year,
Particularly a thick, big one like this.
thick skin noses, it can be a year and a half. I mean, because it takes a long time for the skin to remodel after something like that. And, right now, you're probably still pretty swollen, and that's okay, which fine.
So having done a few thousand operations myself, what I was really surprised about was
The recovery?
the recovery was not easy.
Oh my God. I'm curious, guys. I wanted to ask you too, because you were saying that you had some things done.
Yeah.
And you're obviously a plastic surgeon. He was such a baby about the whole thing. And I was like, do you feel bad for your patients now when they're in post-op day
I was a baby
1, 2?
post-op.
I mean, no, you were a stud. That's
I've
what
had
it
my
was.
hernia. I was a stud with
You
that.
were.
Yeah, and that's
Not this so
super
much.
painful.
He was just like, this is so painful.
It was shockingly painful. The numbness was bizarre, and then the weird neuralgia that I developed, where I wanted to like. And by the way, every time I have a procedure, I get a neuralgia. It's a really weird phenomenon. Yeah.
Yeah, you had that with your hernia,
the
too.
hernia, and,
I had that with my umbilical hernia.
that's right.
Yeah.
But
Did you have it with the nose?
oh yeah, and so
What was going on?
intermittently, like I'll be somewhere and it'll start to really itch, and I have to like, But even the tip, it's typical stuff. Nothing
Yeah.
unusual stuff. Nothing I don't expect, and it is resolving. But it was much more of a recovery than I thought. What's funny is a friend of mine that you did, who's a plastic surgeon, by the way. I was talking to him about 4 days before, and we were there shooting the stuff. And I said, "Oh yeah, Jay's gonna do me." Oh yeah, he did mine too. And I go, "What's the recovery? It's not that bad." He goes, "It sucks."
He did have a rough recovery.
I go, "Really?" He goes,
Now I know
"No,
what you're
it
talking about. I
sucks.
just
It
remember,
sucks." I go, "Yeah, but I'm pretty tough, I can eat razor blades, and it sucked."
Yeah, it does. It sucks. I mean,
It's no
not,
joke.
It's not fun. That's for sure.
And I can't take opioids.
Yeah, those are hard.
I think if you could take opioids, it's
easier.
1,000 times
or the Valium
better.
or something.
Yeah, I don't do well with Valium or opiates. So I
Percocet, none of
tried
that,
the
yeah.
Percocet for a day and a half, and at first it was like tolerable. But I remember the only way I go into my Buddhism heads. I just sat in the dark, sitting straight up, just looking ahead, just going for like 3 days,
Wow.
and I got through it.
That's rough.
So I guess the next question is, when were you back in the OR?
Very quick. Oh no,
8 days.
you told me you take 5. I did. Normally I would take 3 days off and be back in the OR, but I think you said, dude, you better take. I took a full week off. So I did. You do it on a Monday or Tuesday?
We did it on a Friday. Yeah, because then
Took a full week off.
Yeah, because then Friday night you came to the Viper Room gig with your new nose. I remember that when we were playing with Bo. That
Right.
was 1 week after.
But
Was it?
Yeah, that was 7 days after that that operation. Because I did a post-op that day, I think.
so you took the splint off
Like day 4.
day 4.
I took it off on day 5 because I came on Wednesday to the house.
Okay,
we
so
did
you
Friday.
came on Wednesday, we
came
filmed.
Wednesday because we didn't do
Yeah.
osteotomies. So
Right.
I said I can take the splint off because it's just there for swelling. So
and
we
I
took
went
that
to
down.
dinner that night.
You went to dinner. You
Out.
sent me a selfie from dinner.
Steak 48.
This looks great. That's right.
Hey.
I was at Steak 48.
Yep.
That night, 5 days out, and you couldn't tell.
No. Yeah,
Isn't that amazing?
But isn't that also because you didn't have you didn't
That's what we
have
say,
to
the
that's the
osteotomy.
osteotomy.
Yeah, the
it's
bone work.
breaking.
Yeah, because we didn't
bruising.
have to do bone work for him. It was all about soft tissue in the septum. The reason it hurt so much was because of the septum was bad.
Yeah.
That's why you couldn't breathe. So, yeah, I mean, yes, the tip's down too. That was a big part of it. So what you're doing when you're trying to fix the airway is create laminar flow. This is the idea. You want to be able to have straight flow through the nostrils, through the airway, back to your pharynx. And with the tip down, you can't get that. With the septum in the way, you can't get that. With the valves collapsed, which you had all three.
I'll tell you, it worked. My breathing's much better.
Much
Yeah.
better.
Wow.
I can attest to
How
that.
about the snoring?
Much better.
I can sleep.
Great.
So I've learned how to sleep on my left side because she will. If I sleep on my right side, I will snore,
and his back. Can't sleep on his
and
back.
she will push me over.
Right.
So
left
I just,
side, he's all good.
Left side, I can sleep. So now I can sleep on my right or my left side.
Yeah.
Oh, wow. That's
Yeah.
great.
So it's good. It's really good. And then I have this weird relationship with pain. I weirdly like pain. So like early on, I would like mess with it just so I experience some pain.
Great.
Isn't that a weird phenomenon?
That's a little
No, it's like people that poke a bruise. You know?
Yeah, I would dig a bruise. Yeah.
Oh, that's funny.
So, but it's been what's amazing about it is it not only improved my breathing, I just better.
It looks better.
It feels better.
It's in the right place. You can breathe better.
Yeah, no one would notice. No one has noticed. By the way, I saw Paul Nassif 2 weeks after.
Your Botched co-star.
Yes, and he didn't notice. And I went, okay, good.
Yeah, and why would he? Because you don't look that different.
I don't.
That was the whole point.
I don't look different. I guess So in terms of like what other procedures I would do, in case you're interested,
I am.
I'm interested. Go.
So I will not have a facelift. I could use a facelift. I will never have a facelift.
But why do you say that so emphatically like that? Like, why
Because
is that
I
a
think-
hard line in the sand?
I think a guy, when he gets into his 60s, starts to look, no matter what they do, like they're in their 60s, okay? And so as I approach my mid-60s, later 60s, early 70s, I think it's weird if you don't have any lax skin. It looks sort of abnormal.
Yeah,
I hear you
I
on
could see that.
I think like Robert De
Like our people
Niro.
we saw yesterday.
So there was a point where maybe one of them, Pacino maybe, I don't know, had a facelift at a certain age, and it looked good, but it looked like, but if Al Pacino were to have a facelift now, it would look weird.
Yeah.
It just,
Do you
there's a
think Biden looks weird?
discordance.
Yeah.
I think Biden looks weird.
He's very tight.
Yeah, he looks bizarre.
He looks weird.
It's very tight.
And
It's
so-
Botox as
Yeah,
well.
he looks bizarre.
I think at a certain age, it just doesn't look. It looks discordant. That's visually discordant to not have some lax skin in your neck and maybe some jowls, And so for me, I don't want to look that way. I mean, I just had my hair dyed today, and I think it looks a little discordant. I was looking at a guy who looks my age shouldn't have. It's also a little funky brown, but it shouldn't be this dark.
Right.
You know what I mean?
I get what you're saying.
There should be. And so. I don't want to do that with plastic. What I'd like to do is, for example, I have a lot of dyspigmentation on my face.
Right.
A lot of it. And we talked about maybe you lasering it before, but I didn't want to recover from that and the nose at the
That would
same
have been
time.
a lot.
Yeah, I was going to ask you to do it, but then when my buddy, who you did so successfully, said, "Oh, it sucks," I said, "Oh, I'm not doing anything else then."
Yeah, the
Well, we
laser
can
would
come
have
back
put
for
you
the-
over the
the
top.
laser would-
I think so.
Sure. Yeah.
That's a really interesting point because I do a fair number of male facelifts, and I'm just kind of reviewing what they look like, and I think my patients look really normal. And it's because I don't put these same incisions on men that I do on women, and so I think you could do it and still look like you, but you don't have to. Obviously, I would go if you're really going down that road. Let's do some lasers. Let's do some Morpheus. Like Morpheus is great.
I like
they're-
Morpheus.
Totally. Yeah, I mean Morpheus is.
What's the other thing I just did?
So you do
Thermage. I did a thermage.
People love Thermage.
I liked it.
Yeah.
I like it all.
Yeah, I mean,
See, as you can tell, Heather has
non-surgical-
never had a facelift.
right. Yeah.
To all the
Nothing.
trolls
But
out
Heather
there,
would look
there are no
incredible
scars.
with a really good facelift, and that's the key.
Yeah, but
She looks incredible already.
Yeah.
But you don't need to do anything unless you really feel like you need to do it. That's really the truth.
Right. I certainly think she will one day. But
She doesn't need anything. Like, she's got a good jawline. It's
that
there.
right now she looks great.
I'm just going with the flow. It's very difficult to be 55 and on high def television,
Yeah.
right?
I bet.
And so, I'm obviously not against plastic surgery. I think it's amazing. I just emotionally, mentally, whatever it is for me, and I know it's crazy because I'm married to Terry, but my joke is I'm the only plastic surgeon's wife with real breasts.
True.
You're not wrong.
It could be true.
That is true.
Of course, I would probably be allergic to them because I'm allergic to everything plastic, latex. I mean, they would jump out of my body. But I mean, yeah, someday maybe it could happen. But right now, I really like doing the non-surgical things. I like the Morpheus 8s and the
work.
Thermage. I like Sculptra. I like a little Botox
Gold needles.
sparingly because I want my kids to know that I'm angry with them. And I love the Aqua Gold needles. I think are great. I also go to Dr. Ellie, who does this fabulous, I don't know what she does, like salmon sperm facial, and they inject, it's really good. It's like Korean. Fabulous.
How do they get the sperm from the salmon?
By the
way, that's the first
question
I want to
I
know
asked
about
her.
that. I want to see how that happens because is there I got some visuals.
By the
but
way,
it's all
There's a
different.
reason
By the
it's
way,
so expensive, Jay.
it is literally, if you think about it, catch and release.
How long have you been waiting?
I was just going to ask that.
That was up and good.
I swear to life,
That was amazing.
I just thought of that.
So good.
Catch and release,
But
get
it
it?
does ask the question, being on television, like what someone
was
looks
worthy.
like how do we see people at different ages? So, there's a big meme on Instagram that shows you the cast of the Golden Girls and the cast of Sex and the City, and they're the same age.
Yeah.
Yes, I've seen that.
Same age.
Yeah.
And so that's what, 55 looked like back then. And this is what 55 looks like now. But
know.
if,
That's good.
as I continue to age, if all of a sudden 60 and 65 and 70-year-olds are looking like 45 and 55-year-olds, then that changes things because then the standard is different.
That's a lot of pressure.
Yeah.
That's huge.
You know, it's interesting. What I've noticed, and I'm certainly not going to, as I'm sure you guys don't, maybe you do, I don't know, list celebrities and surmise as to what procedures they've had. But I've noticed there's about 5 male celebrities about the same age who were on, and still famous, very famous, who are on major TV shows and movies, who you all know, if I mention their name, boom, 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 who've now just recently in the last couple of years have had facelifts.
Yes. We just talked about
We
this, as a matter of fact,
literally-
because we never do it.
We do it. I
Right.
hate the topic. I hate talking about who has had plastic surgery because the quality of the conversation, the tone is always so judgmental, and I can't stand it. But for some other reason, we were bringing up celebrities that may or may not have had plastic surgery literally 2 days ago. And we probably went through those 5 that you're thinking of.
And they have. They've clearly had
They totally
facelifts,
have.
all of them. And they
look
actually
great.
all look
Really good.
So I think they did it at the right age.
I was going to say when you were talking about that,
Yeah.
so maybe
they're
if
like
you
58,
do it,
59.
then
Yeah.
it ages and you don't look weird.
Yeah, it's true.
Yeah.
So I think
Not too early, not too late.
they did it just at that sweet
Just right.
spot.
Yeah, and if you get a good facelift, I mean, I have a patient that was on the red carpet very recently with her hair pulled like as tight as you can imagine up with her facelift incisions hanging out for everybody to see. She's interviewing, and I'm watching it on TV, and you cannot see her incisions to save your life. And she looks amazing, clearly has the confidence to wear her hair totally
Right.
pulled up.
Right.
I mean, I was just like, and she was going, oh, and my dress is by Armani, and my shoes are by so-and-so. And I was like, and facelift by Jay Calvert? Hey, where's that credit? I didn't hear that one.
Never. That'll
Yeah.
never
Right,
come.
because
No.
celebrities.
No chance. They don't have
if
plastic
everything
surgery.
goes great,
Yeah.
they say nothing.
Of
if
course.
there's a problem, they tell
Right.
everyone.
That's the
They'll
thing
sink
people
you if they
don't
don't.
realize is that, like, you don't know who's had great plastic surgery walking around. So people think, like, oh, plastic surgery, everyone looks so fake. That's because you just don't know the people that have had really good plastic surgery.
I don't believe people should have to say what they've had done. The only thing that annoys me is that when there's someone that's had plastic surgery, and I know for a fact they've had something done, and they are asked about how great they look, and they say, oh, I just drink a lot of water and I get rest. I mean, that is an unrealistic
wrong.
expectation to set up for people around the world that are going, oh, I just need to sleep more and get rest.
And drink
I
some
will
water.
look like
It
that.
drives me absolutely bonkers. Totally.
It's like the Ozempic deniers.
Oh, yeah.
I've been heavy my entire career. You've seen me on television, 50 pounds overweight, and suddenly I have no body fat. But it's menopause.
Yeah.
You go, menopause?
No.
That's what did it? What are the other excuses they have?
Peptides.
Walking.
Walking.
Lots of walking.
And it's like, be on it. It's a miracle drug. And it's got
Great.
apparently so many other side benefits, also cardiac and otherwise. Go be on it. Don't stop talking about it. Just don't talk about it.
Yeah, I agree. Either don't talk about it or admit to it.
Yes.
But don't sidestep it and don't blame it on something that's
It's
absolutely
not
unrealistic.
water and fresh
Yeah.
air and walking through
Yeah,
Manhattan.
it's not. Just don't lie.
And the thing that we were talking about with that podcast, though, is that we were talking about facial harmony and how you can create a beautiful look with facial aesthetic surgery. Because the one of the plastic surgeons that I know, and I won't say who it was, but he called me about one of my patients on Instagram and said, like, you have to tell me how you did that. He was kind of like, I get that she had a facelift. I get that she had a brow lift. I get all that. Like, why does it look like nothing happened? Like, why does she just look like, somebody transported her and put her in a washing machine, took her out? He was like, really kind of like, what is it about the way that you're doing that? They look normal. Like, nothing says that she had plastic surgery. And I kind of went through, that's what we talked about on this podcast, where we were saying, well, it's about having vision. It's about artistry. There's a lot to it that's hard to put into, like, this is the instruction book for how to make people look good. But it is really And I always say, like, Terry Dubrow does some of the best male facelifts I've ever seen. I've said that for years.
I have heard him say that many times.
I said, you cannot get over how good these guys look. And they look totally normal. They don't come out looking like they've had facelifts. And it's because your female facelifts are fantastic also. It's easier to do a female facelift. So I can't say, like, there's something magic about everybody's female facelifts. But Terry does something for men that they just look normal. They look great. And it's about the artistry. It's about not overdoing it.
Yeah, it's the lighter hand, I think, with men for sure, especially men's eyes. And I think that's what you were going to get to with what procedure you would do.
Oh, I think I would do my lower lids.
I thought you said
I need to do mine.
And maybe a slight amount of the uppers and the lowers.
Yeah, the lowers need to be done for me.
Yeah.
For sure. I'm ready to do them.
Yeah, I think that makes you just tired. That's not sort of like the droopy nose, you're ugly. But no, I mean, the droopy nose, it's an attractiveness scale thing, really, or pleasantness to look at. But
well, a nose is in the center of your face.
Yeah.
I mean, there's no getting around it. You got funky ears or whatever. Okay.
But the lower eyes, you just look tired, even when you're not. And by the way, we look tired because we are tired. Because let's face it.
Yeah.
And you're many years away from this, but it gets to a point where no matter how much sleep you get, the very next day, we're not going to get sleep for the next 9 days.
No, it's true.
For the last 2 weeks, I've been getting up in the 4 o'clock hour and operating 6 a.m. every single day. Jeez. Every single day. And getting up at the 4 now that I'm sort of commuting.
Not for long.
And so, like, even if I slept this weekend, Monday morning, I'm still going to be looking terrible at this age of life. No,
you're going to be in Idaho.
I'll be in Idaho. We're going to Idaho Sunday, Lake Coeur d'Alene.
Oh, beautiful. That's very nice.
Yeah.
Well, I think, it's all about the harmony. It's all about making things look good. And I'm glad that you're happy with your harmonious nose.
Oh, my God. First of all, I just want to tell you, all right? I'm awesome. No, I'm kidding. Because I'm about to say. No, you did exactly. You're fantastic. I always knew this. Everyone knows how a fantastic surgeon Jay Calvert is. But you did exactly what I wanted. Let's face it. I could have come in and said, "Give me something more radical," and you would have done that. I could have said, lift up the tip way up, decrease the tip, and then end up on Botched or something. But
and then Paul have to fix it.
But I said to you, it's funny because I said to you, give me like a B+.
Yeah,
you're used to an A.
You did say that.
I said, give me a B+, meaning leave it a little undone.
Because you didn't want to look altered.
I don't want to look altered because then they're going to rag me about that.
Interestingly, though, if we really take a before and after, which we'll do at some point when it does calm down, you're going to see that it is actually radically different.
Oh, I know.
How many?
Radically different.
How narrow did you make it? You told me at the time it was like 7
Yeah, I took like 6 or 7 millimeters
off of each side.
Each nostril.
Yeah.
That's a lot.
It's a lot.
Yeah, it was a lot. But it's because the tip was so descended. Once I brought it into position, it looked really wide. And so I had to take out a ton of nostril, which I did in a way that he still looks like, the great Terry Dubrow, which he needs to,
And then you put in the cadaver, which I said
we
hello
didn't use
to.
his rib. Yeah.
Which I said hello to before as it was entering the OR. Do you remember that?
You did?
Of course I did.
I wasn't there. I was asleep, right?
You were asleep.
You were asleep.
You did make a joke over and over again, which was hilarious. Once
$1
you were
million
getting
is
$1 million is buried in the.
Well, that's a joke we've been saying for.
It's actually a joke with me and my sister from childhood.
Yes, but then you taught me that one.
Yes.
The problem is $1 million now.
I know. Heather was like, Terry.
That's it. Where's the rest of it?
Well, that's like Austin Powers when he goes, give me $1 million. And they're like, okay.
That's not very much.
And he goes, oh, never mind. $1 billion.
And now, actually, $1 billion wouldn't be enough for him either.
No, not at all.
Think about it.
$1 trillion.
I think
now it would be $100 billion would work.
$100 billion's good.
That's a lot of money.
That's a lot of money. We'd take it. Yeah. Well, I really appreciate you guys coming in to talk about this. This has been great. And we don't want to keep you all night because I know you got dinner plans, and we're just happy that we could talk to you about the experience.
I wasn't finished. I just wanted to say, not to be rude.
Okay, no.
Not only did you do exactly what I wanted, obviously I'm a high profile, but I know you do this anyway for all your patients. You called me at just the right times. You saw me at just the right times. It was
Great
very
follow-up.
The follow-up was
Office is amazing.
perfection. Your office was amazing. It was as an enjoyable. I mean, in a weird way, I enjoyed it because I got to take some time off. But it was an enjoyable experience as possible. You know, it's pathetic that we work. You guys are probably the same. I know you are. You work so hard that sometimes the only break you get is when you're having like a colonoscopy.
Oh yeah,
Well, you need
to me
medical
that's
care.
it's a
Yes.
spa. It's a spa day, a
Yes.
colonoscopy.
I love
They
the
give
dentist.
you propofol.
There you go.
You get to relax.
An excuse not to.
Just sit there and not do anything.
Yeah.
Checking
Isn't it
out.
amazing how hard
It's
we work? Isn't it amazing?
Yeah, it's hard. It's hard to get time where you really have quote unquote downtime.
Yeah.
It just doesn't exist.
But we're lucky because we do have the greatest jobs.
Yeah,
in the
I know.
world.
Can't really complain.
It's really fun, and there's something so enjoyable about just doing what we do.
Oh yeah.
You know what I
Of
mean?
course.
The actual doing of it is just so zen and so mindful and immersive, and just lose yourself in the moment. But anyway, you did an amazing job, and I
Thank
can't tell you
you.
how much I
Of
appreciate
course.
it.
Yeah.
And
Absolutely.
so-
It's my pleasure.
Yeah, and I'm sure they can see it, the process.
On Real
On Real
Housewives
Housewives
of Orange County.
Oh yeah, no, I mean that's going to be big. I mean, but you know what? It was one thing I will say is that like doing it on the show really didn't have any impact on how I did anything or any of the.
By the way,
changes.
we
I mean,
weren't concerned about that at all. So
Yeah, it was like-
so sometimes putting procedures, I get nervous doing things like that if someone isn't used to being on camera. Like I had an epidural once, and I had a couple of them for my back over a few years, and I said, "Oh, this will be fun. I'm going to put it on Instagram." And so I had him do it, and that was the one time I ended up with a complication.
Yeah,
I had to
never
have
do
a
that.
blood patch, and I went, "You know what? I am never doing that again." But with
Yeah.
you, I mean, you've obviously
Been doing it on TV for a long time.
Yeah.
But,
Sure.
but I would recommend not having your doctor film your operation in general, unless they're a person who's used to speaking in public, being in public. Because even now, when I do a botch case, if it's a really like, why am I doing this? This is so impossible. Why am I? This is so high risk. They bring the cameras in. I go, ugh. And so what I've learned to do, of course, with Botched is, I get started and I kick them out,
Yeah. Say okay.
and then I solve the
Right.
equation. And as I've solved it, I go, okay, now I bring them
Right.
back in and just time lapse it and go, oh, I'm going in this section. Oh, look at this. I see dead people, whatever
exactly.
joke I'm going to make. But I think it's the same reason why you don't operate in general, unless you have special skills and experience, on your relatives.
Yeah.
I don't know if you guys talked about that occurrence that happened in Florida where that guy was operating on his wife under local. And she started to see orange. And then she started to get all excited. And sure enough, she arrested. And as she was developing this lidocaine toxicity,
Jeez.
the staff was saying to him, should we call 911? He goes, no, wait. And of course, she goes into full cardiac arrest.
Oh my God.
He still waits to call 911.
What?
He's trying, CPR, the whole thing. And finally, he says, call 911. They called 911, and they got there, and she didn't survive.
Why is seeing orange significant?
So
Lidocaine.
lidocaine toxicity.
That's the first sign of lidocaine?
Nah,
That's kind of a later
around your
sign.
mouth.
Ears tingling.
Ears tingling, weird excitability, anxious.
Really? Gosh, that's like a
yeah.
board question. Oh my gosh.
Yeah.
Oh, that's
So
awful.
and he didn't give like the appropriate medication that you would
Is
give.
there a drug that counteracts
Well, there's two
it?
things you can use. You want to lower the seizure threshold, so you give like a benzo, like a Valium kind of
Yeah.
thing, and two, you can use intralipids.
Yeah.
yeah, propofol.
Yeah.
Yeah. But
That's
anyway,
terrible.
they indicted him for manslaughter.
Because he didn't
Murder
call.
too.
So the
'Cause he didn't
question
call.
is,
It's so beyond
it
the
hadn't
pale
been
and
his wife-
so reckless. Oh, thank you, bringing me back to that. Had it not been his wife, I'm sure he wouldn't give too much local because you'd be paranoid, and you'd immediately call for rescue.
Yeah.
Because it's like, oh my gosh, this is my. And so the fact that he did his wife. He lost perspective. He wasn't objective. Maybe
it's funny,
He
I
was doing
would have thought
shortcuts.
the opposite
Yeah.
would be
And,
true.
and what's weird is his wife. No, you tend to do shortcuts on your family, And his wife.
Mental note,
It was a
okay.
very weird practice. You can look it up.
We'll talk about anything
Yeah.
you need to do. We know where you're going.
By the way, I was just interviewed on Nancy Grace's show for this. I was the plastic surgeon guest. But anyway, he had a weird relationship with his wife because she worked at his office. She was the office manager. Even though she had no medical training, she sutured up her own wounds.
What?
So he was doing stuff on the face and the body and maybe a scar vision or her abdomen, and she sewed it up before, of course, the lidocaine toxicity kicked in.
Jeez.
You got to look it up. It's the most amazing.
During that same
Board certified.
We will do an episode about that.
By the way, general surgery trained.
So everything we talked about in the beginning of the podcast is just out the window.
go to the dentist.
Don't, by and large,
Go to Tijuana. I take it back.
by and large, go to someone and pay them the appropriate amount of money and let them do it. Someone you're not related to. Unless you're Jay Calvert and your kid has a very difficult nose, you're going to do it. Right?
Well, that's what I always feel like. I feel like if you're relative, if you're operating and it's only you, that you're such an expert in that particular
Then you're doing
field.
it.
Right. You don't want someone else to mess it
we
up.
told the story about, Chris, I sent her to a world expert to get her nose done, and it got demolished.
Oh, is that right?
Yeah.
And you had to fix it?
And she said, you are a world expert.
Yeah.
I'm not going someplace else where I have to, and I did it, in 2010, and it's been fine. I did a rib graft on her, the whole deal. And it was, it looks great to this day.
So I don't operate on.
She's gorgeous.
I don't operate on family unless it's something really unusual,
Silly,
or friends at all. I don't want to ruin the relationship between me and a friend. But Heather occasionally will have a friend come in, and I'll go, I don't operate on friends. And then they show me something, and it's so like in my wheelhouse, like a bad symastia or something, or some real bad malposition with all of, bad double
One had
bubble.
a weird knuckle
Yeah,
situation.
a weird knuckle because the pectoralis had been moved peristoneally too much. It was weird. And I looked at it, I go, I'll do that.
Yeah, I should do
need to
that.
do that because I've done that 15 times, and any of these guys down the street, if they've done it once, they've done it once.
Right. Yeah. And you can do it.
And it's the learning curve. It's not that I'm so special, but you get good at what you do all day.
Right. And that's kind of my rule on it too. I won't do stuff on, anybody that I know or kids unless it's something that I really do. I mean, doing like even operating on Millicent here was like it's not high stress for me because I'm good at what she asked me to do. In fact, she scrubbed in on like 3 mid facelifts with me, and then she's like, "Okay, we're going to do this next week."
I'm next.
Right.
I mean, she literally is like,
See one, do one, teach one.
Right.
Get one,
Do it. Yeah, exactly.
she's literally like
You
coming
missed
to the
that
OR.
part.
She's like, "Okay, let me see you do this."
But to be honest, and no offense, you are the type of person who doesn't necessarily get scared, rattled.
No, he's
you
not.
can be
You're
in the
very
middle of a
even.
disaster and you sleep all night.
Absolutely.
Me, I'm not really that kind of guy. If something is impending, it will affect my sleep. I'm much better at it now. But now, obviously, I can operate on camera. I can operate on relatives. I've just done so much. You know what I mean?
You jump out of an airplane without a parachute half the time. That's how you do this. You figure I'll get one on the way down.
Yeah, I know.
There'll be a store.
Yeah.
He does. I mean, the stuff that he does is like totally. It is 2 to 3 standard deviations off the bell curve.
Yeah.
And no one else wants to do that stuff. And for you, it's just like,
Tuesday.
this is what I do today.
Well, thanks for taking care of him. I
Of course.
appreciate you and your office.
Yeah, no, he's been an easy patient. I mean, I didn't even know about this neuralgia thing first. I've heard of it today.
By the way, so I said to
He was
myself,
he was like, I'm never telling Jim.
I said to myself, because why do you need to hear this? This is part of
Because
normal
I need to
healing.
know, yeah.
It's like my teeth itch. What are you going to do?
No, because we're friends, and I
Scratch
also.
him, I guess.
I mean, we're friends, and the neuralgia means nothing is going to burn out anyway. And I don't even want you to think, oh gosh, I did this on my buddy. It was
he's
Terry
whining.
Dubrow.
me with
I
the
did the-
neuralgia bullshit.
I mean,
he's such a whiner.
I mean, let's face it. I wouldn't necessarily want to do the Botched Doctor on Housewives. That to me is
What were you thinking,
out
Jay?
there squared.
That was jumping out of an airplane.
That is jumping.
without a
I mean, are
It
you
was. I was
kidding
like-
me? You're taking the Botched Doctor on Housewives and operating them. That is more than I've ever done.
Listen, I was like, how many shields am I going to need if this does not go
Right?
well? Or should I just move to Alaska?
No. No,
maybe that's
no, because-
Anchorage is good for
No,
plastic
because
surgery.
even if I had a major complication, even if I would have let you fix it 100 times before I would let anybody know about
of course.
it.
No.
You know what I mean? You were safe with me.
Well, I did know that, but at the same time, I was kind of like, the Housewives is a show that has a reputation for, it can be a little aggressive.
People
Yes,
are
it
going to,
can.
let's be honest,
Little aggressive.
people are going to see it.
Yeah.
it's
That's
going to
for
go
sure.
viral.
And this is a big season, too.
Yeah. Well, I appreciate the opportunity to do it because, I mean, why not? I'm happy to. I would have done it for you no matter what,
I
obviously.
know you would have.
By the way, it wasn't free. You paid for it,
Yep,
which is,
yep.
I do want to put that on because everyone's like, oh, he's going to.
No, I paid for it.
I don't do
Gotta
free
pay.
surgery.
I don't want it. I don't want it free.
No, you don't. And also, it's for real. If you don't, I've always said this: if a patient doesn't pay for something, they're not going to appreciate it. So, like, I don't do free surgery that way. It is a service. It is something I do. But at the same time, you did get a friends and family discount, which
I did.
I know you appreciate. It was
A
good.
very healthy one. But I absolutely,
Because you're friends and family.
No, I appreciate that.
Yes.
But for free, no. It's weird.
Definitely not.
And there's kind of a weird karma when you do stuff for free.
Yeah.
What is it? No good deed goes unpunished.
Something's going to go wrong.
Well,
Right.
you did a good deed by coming in and doing our podcast.
Well, I
and
appreciate
we
it.
really
Happy to.
do appreciate it. It's awesome. It's great to hear from both of you. It's long overdue, and we are definitely going to look forward to the future. All the things that you guys are going to do. I know you're in the thick of it right now.
We are massively in the thick of it.
in the thick of it. There's so much more coming from the Dubrows. Everybody
Particularly
stay
this one.
tuned.
Stay tuned.
All right.
All right.
Well, in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.